it was what we didn't note when we did the initial exam on him. We didn't note it until I got there for the anesthesia, was that he had that hole along the gum line where it had been abscessing on that left side. Right there, what's referred to as buccally, so that bigger opening that's on the side was already present, and then the holes on basically the bottom side of the hard palate on the top is where the teeth were extracted.
Okay, and then so the hole, is it the hole that was present before you extracted the teeth? Is it on the inside of the soft palate, or like between the cheek and the teeth?
Exactly, that second one. It's between the cheek and the teeth.
The cheek and the teeth. Okay,
right,
that's where the hole is. Okay.
Another thing, I think I mentioned this. What we noted too was it was quite a level of infection, because you could see through to the bone there that the teeth are seated in. It's why he may need an even longer course of antibiotics. Wanted to have somebody check it after the course is through, just to see if he needs to continue the course of antibiotics, because it looked pretty expensive. It might even be in the land of needing a referral to one of the pet dentists to make sure that the bone is healthy itself, but don't really have any guidance on that. It was one of the first times that I've seen one that abscessed quite like that.
I see. Do you think that it might have been better before extracting the teeth if it was something you hadn't seen before, to maybe just not do the surgery and then I could have taken him to a dentist? Or do you feel confident with the work that you have done?
I feel confident in the work that we've done. I would say that it could not have hurt to revert to a dentist. It's the kind of thing that you may end up there either way, but you may not have to do as much extensive work with them. They may be doing more referring about looking at the x-rays of it. I do not know enough about the advanced dentistry, working with the actual jawbone itself and reconstructing it. I know I've read about newer, 3D printed replacement parts that they can add to the jaw if that jawbone breaks down. It's one of those things. My major concern with rocks is that if we hadn't gotten that under control, and there's still the chance, since the bone has been eaten away there a little bit, that could break eventually. It's got a strongly reduced chance now that we got the infection out of there, but it's the fact that bone looked infected to me. I couldn't guarantee it was, but I didn't like the way that it looked under there.
Did you happen to take any photos while he was under?
I have been kicking myself ever since, because I wanted to send a photo to a friend who is in dental specialty right now, who I just wanted to run it by them. If you're able to just lift up the gum on that side, has it fully healed up in there?
Say what?
Has it fully healed on that side, or
well,
do you still see that original one? Because that wouldn't have necessarily been bloody. It was mostly undisturbed where that was happening.
So I was going to ask you a question about that, because how long did you say the gums were going to take to heal after the extraction?
With how extensive his were, they were probably going to be about 3 to 5 days, but possibly even longer with how infected those tooth roots were.
The tooth roots. Okay, because I think I was reading online that it might take up to 2 weeks. Whenever there's an extraction, it's not 3 to 4 days.
And, to be fair, it could be a bit longer, especially with how infected that those teeth were. There's a good chance that it may take a bit longer with the gums themselves. Is he bleeding at all?
He was bleeding. I don't think he was bleeding today, but I need to get him outside so he can naturally pant and so I can look in there.
Yeah, definitely.
So I'm doing that. And then
acting normal too, otherwise.
He has been whimpering still a little bit. He's not agitated, but he is, sometimes he'll rub that side of the face on the ground, like trying to massage it in the grass. Yeah. So I think overall he's doing pretty good. I just, the holes in there are pretty big from the extraction. And the other thing, I just wanted to make sure, since, he's 13 and I need to monitor him, can you remind me, so with the anesthesia, can you just tell me what that was so I can write it down? What was the pain was it an injection you gave him 2 of? And what kind was it, and how much of it?
It was buprenorphine. It was 2.2 milliliters, if I remember correctly. It's an opioid pain injection. It is a normal part of many anesthetic protocols, but not always ours.
To give that much?
Yeah.
And then what would it...
To give that much, yeah.
And then normally, so you said it was supposed to be a muscle relaxer and a pain injection, correct?
Yes, we usually use ketamine and midazolam.
Ketamine? Oh.
Yeah, it's a great dissociative pain reliever.
Muscle relaxer?
Fantastic for that. It means that they often do not really have any idea what's going on around them.
But he did not get it. He did not, or he did?
He did get ketamine.
Okay, what was the thing that the muscle relaxer he was supposed to get, but he didn't?
Meloxicam.
Okay.
Or sorry, midazolam.
Okay, gotcha. But the anesthesia was fine other than that?
Yes, exactly. I went to check the book as soon as I noted what had happened, and the only things they describe, they do not describe any long-term negative effects. It is effects around the time of the administration.
Okay, that's
during
helpful.
those 8 hours, some concern, but respiratory depression, so he would have had a reduced respiratory rate. His respiratory rate was quite fine. The other condition that you're worrying about is just trying to watch the heart and make sure that it's still beating fine. We didn't have many concerns, or really any concerns, with the anesthesia. He was very normal on his heart rate and very stable on his oxygenation. So,
okay, thank you for that. And then the other thing, so like, just so I understand the procedure, because this is the first time I've ever had to do this. So after he was discharged from there, I guess, why wasn't it a thought to give him pain medication, knowing that that it would wear off 8 p.m. that day? So he was in pain all night and the next day. Like, what was the thought process on that, just so I understand?
Yeah, it's not necessarily a clinic policy. It is our general rule of thumb that we are a little bit reticent in some cases to do pain medication off the bat, because of the fact that it has side effects. You know, especially in older dogs, I worry about the fact that we could start kidney disease or bring it up. You know, his values still looked fine on that, and I think we discussed on the day of anesthesia, he had some slight elevations in his liver values, but they didn't necessarily affect whether we wanted to do anesthesia or not. It's more about what we would look to going forwards as far as other conditions. There's number one that comes to mind. Okay, so it's 2 different liver values. It could just be liver disease. It could be cholestasis, which is a reduction in the amount of cholestasis that's performed. So the ability to produce bile, so helping with the digestion. It gets added right there near the stomach on the digestive tract and helps to aid in the digestion of all our foods. That could elevate the ALP and ALT. It also could be liver disease. It could be a third condition, not really one that's on my list, at least not from any clinical signs we talked about, Cushing's disease. Which is
so I guess my other or
the second most common endocrine condition of dogs. Go ahead.
Okay, thank you. So my main concern is, since he's a 13-year-old dog and you did moderate extractions and you said that the teeth were in there pretty good, so you had to pull pretty hard, like, why wasn't it a thought to manage his pain? That should have been the top priority in my mind.
We just often worry about the side effects. It's not like they don't ever come with side
and
effects.
And nobody talked to me about the pain he was going to be in. Nobody mentioned that at all.
I'm considering asking clients about it, because some clients would prefer to have some going forward, and I'm considering changing how I address it.
Yeah, because, you know, like, he cannot take back the pain that he was in. And I can't. I'm only here to advocate for him. And to me, that felt negligent from a doctor who's treating a 13-year-old dog, not managing pain, especially because this was not just like his teeth were falling out. You said they were in there really good. So he was in a lot of pain. And I know that's not your intention. I'm sure you care about animals, but how can we make this right?
Absolutely. And I understand that, and I'm sorry, it's something that we are, like I said, considering changing. I think that it might include more discussions and giving out of paperwork that describes side effects to people, because that's the other side of this, is that we have mishaps or situations where we have given out pain meds and then the dog comes in with bloody vomiting or diarrhea, which is one of the major side effects of the meloxicam. It is something that I will consider more going forward, especially after what happened with Rox. And I apologize for how you feel that everything went with Rox.
Yeah, and the pain he was in, and the other thing of what happened with the woman who dragged him out there while he was still drugged up. And again, I was there early to pick him up from the back room, so he did not have to walk.
She's been spoken to. She is on vacation right now. He's going to kind of check in with her again after she gets back, and there will be a little bit of monitoring.
And what was her reasoning for that?
I can't give you a good one.
Okay.
I was not here for that discussion he had with her. It happened the next day, but I've not heard a good reasoning. I mean, yeah.
Okay, thank you I really appreciate
something that we're going to look to correct there for that one, definitely, because I agree it's not.
Yeah, he was drooling from the mouth. He was dragging his back feet. He was disoriented. Like, there was no reason for that. So in this first procedure that I had with that clinic, there were 3 red flags or 3 strikes in one procedure. And so I don't want to take you guys to small claims court. I would rather, I would prefer you just refund me all the money that I've spent there, because Rox cannot take back the pain that he endured because of negligence. And I've done enough research to know that it is standard protocol to give pain medication after there are moderate extractions. So I just want to, let you know that, let you think about it, maybe talk to the owner, but I'm looking for a full refund of everything I spent there.
I will talk to him about that. That is definitely an option. What I will tell you is that we did offer the pain meds the very next day.
Yes, but he was already in pain. He was in pain from, like you said, the pain injection wore off at 8 p.m. the day of surgery.
And I can tell you that there's no guarantee we would be able to actually cover every bit of pain he had.
Oh, for sure. I understand you can't. But the fact that nothing was given and nothing was discussed at all, and you and I had a conversation on the phone when I picked him up. So nothing was discussed about, hey, he might be in a lot of pain. You know what I mean? So he was up all night whimpering, could not get settled, and that was pain that could have been avoided. And that's what I feel like we pay doctors for, especially since he's 13. So we can argue about this, but I feel like there was negligence.
I'm not trying to argue with you. I'm sorry, Ms. Kirkwood. I don't mean to give that impression.
And I get that you were able to...
that, number one, some of that is out of my control. I do not own the practice.
Understood. So whatever needs to happen, but my dog suffered pain that was not necessary. And the fact that you guys offered pain medication the next day after I called, that does not take back the pain he was already in. And there was just no reason for that. And you knew, because I asked you, I was like, so when do you think the double pain injection wore off? 8 p.m. on the night of surgery. So, like, I don't know, you could have thought more about that. You could have advocated, like, hey, owner of this business.
And I'll tell you that from my experience, we have not, with very similar extractions, those are some of the most common teeth that are extracted because of the number of issues they cause. We have not really had any feedback to give us that sort of negative experience is where we've been with that. Yours is very well noted. It will almost certainly inform changes that I make to my plans in the future. That's what I can definitively
thank
say.
you. I really
that to put you off or anything.
Yeah, thank you. I appreciate that, because honestly, I don't want any other pet owners or pets to deal with things that are avoidable. I know that things are not, some things are not avoidable, but this pain situation was avoidable. We could have mitigated his pain. We really could have. And so if you could please talk to the owner. I hope that you have a beautiful career and that everything goes well and you learn and you make changes, but he was in a lot of pain. And it just felt so unnecessary.
Absolutely. Absolutely. I will speak to him, and yeah, I'll let you know if we have any resolution. Don't know when we may know something, but
I understand.
I'll either reach out or have somebody reach out.
That sounds good, and I won't file anything in small claims yet. I'm going to wait a couple weeks. My biggest priority is to make sure Rox is safe, and I'm finding I'll have a different vet going forward. But I appreciate everything that you've done.
Absolutely. You have a good day, Ms. Cookwood.
Thank you. You too. Bye-bye.